What are some of the precautions that people should be taking right now?
Well, this is kind of the calm before the storm. So this is a time where we actually have a chance to make a difference on the progression of this pandemic across Nova Scotia and Cape Breton. Some of the precautions, well, the first thing is I think people have to take this very seriously. This is a virus that humans have not been exposed to before. And because of that, we have no experience. Our immune systems don't know how to deal with this virus. Now, many people, our immune systems will react and they will have a very mild illness or perhaps no symptoms. But for some people, this virus is able to overwhelm their immune system and to really cause a serious and potentially fatal infection. Some of the numbers I want people to kind of consider is, this hospital we serve here in Chéticamp, we serve about 10,000 people. What we're finding out, we're just starting to find out some real numbers about what this virus does, what COVID-19 does. But we know that, if we're not smart and if we don't do some certain precautions, that up to 70 to 80% of the population will get exposed and infected. So if we talk about our area of 10,000 people, that means there's going to be 7,000 people that will get exposed and infected. We know now about 10% of those people will get sick enough that they probably have to come into hospital. They need supportive therapy, whether it be oxygen, mask, and things like that. So 10% of 7,000 is about 700 people. We have a bed here in Chéticamp that has we have a hospital here in Chéticamp that has 10 beds. So you got to look at those numbers. The other thing we know is, depending on the country and the healthcare system, the fatality rate, the mortality rate, how many people die when they get infected, is around 2 to 3%. So again, if we apply it to the numbers here, we're talking potentially 200, 300, 400 deaths. And so again, this is a virus that we have to take seriously because it has the potential, if it does spread and have those numbers, those levels of infection, it can overwhelm the healthcare system. So precautions, well, the number one precaution is take it seriously. The second is, the reason everything is shutting down, which, some people say is kind of overblown, is we do need as a population to isolate, to self-isolate, and to quarantine ourselves. So that means, no play dates. The kids are off of school, but that doesn't mean kind of sending them around to their friend's house and having play dates. Having friends over for playing cards and things like that. Mika Ram. There's a reason why all this is being stopped. There's a reason why we can't eat out in restaurants. We need to put distance between people so this virus cannot hop from one house to another house to another house to another person. So this kind of social isolation is something that we have to take very seriously, and people have to really understand that it makes a big difference in flattening the curve. People have probably heard, what does that mean, flattening the curve? Well, if we don't do any of this, a lot of people are going to get the virus and you get very sick very quickly. And then our hospitals will not be able to deal with that. If we do distance ourselves, if we kind of spread out, isolate ourselves, just go out for the necessities, then this virus will not infect a lot of people right away. And the amount of spread, it may take longer, but the number of people that are sick at one time will be a lot less. So that flattens, that big spike flattens it down, spreads it out a little bit. So that here in Chéticamp, the doctors can deal with the people that do get sick. Because instead of having 200 people get sick this week, maybe we'll only have 10. And we can help those 10 people and make sure that they have the best care possible and survive. So social isolation is really important. You've probably heard this already, but washing your hands. People need to wash their hands. This is a virus that if you wash your hands properly, so that means good 30 seconds, sing happy birthday twice, and that it kills things. And this is a virus that we are learning now can stay on surfaces for sometimes several hours, if not longer. We don't know yet. And so disinfecting doorknobs, trying not to use cash as much as possible, doing things over the phone, ordering things, getting things delivered to your doorstep. So there isn't this kind of, no shaking hands. That can also help stop this virus from spreading from person to person.
What are the symptoms?
Well, we're realizing that the symptoms range a great deal. So some people may have no symptoms. Some people may catch this and not even know. Many people will have a mild cold. Coronaviruses, as in general, this is a family of viruses. The coronaviruses like to cause cold-like symptoms. So for some people, maybe a mild cold, sore throat, a bit of a mild cough, and it progresses on. Some people can start having high fevers, a cough, usually a dry cough. So people aren't coughing up a lot of stuff. But we're realizing there's a lot of variety in the symptoms that people present. What is concerning is that some people get very sick. And this virus gets into the lungs and causes fibrosis and scarring, fills up the lungs with fluid very quickly. So for some people, it could be a matter of a couple of days. They go from having a little bit of a fever, cough, to not being able to breathe, not being able to get oxygen into their blood and getting very sick. So the scale ranges from asymptomatic, meaning no symptoms, to getting very sick very quickly.
What should people do if they think they have COVID-19?
Well, if you think you have COVID-19, so some of the questions you have to ask yourself: do you have a fever? Are you coughing? Those are concerning symptoms. Have you traveled outside the country? Or have you been in contact with somebody who's traveled outside of the country? That increases your risk. Having said that, as this virus starts to spread, we may start to see community spread, where people who haven't traveled are getting infected because other people in the community are spreading it. If you think you're concerned about COVID-19, first of all, do not go to the hospital. Unless you're extremely ill, having trouble breathing, in which case you should phone 911. But do not come to the hospital. Do not go to the clinic, because the last thing we want is someone who might have COVID-19 coming into a waiting room or going into emergency room where there are potentially other vulnerable people and spreading this virus. So if you think you are ill, phone 811. And there's actually another phone number out there as well, because 811 is getting a lot of phone calls. So, but there are, I don't have that number on the top of my head, but there is another number out there. So phone these numbers, and a nurse is going to then ask you some questions. And if they feel necessary, they will make an appointment for you to go to a COVID-19 testing center. And there are new testing centers opening up. In fact, today in Inverness, at the Inverness Hospital, today on Thursday, they have just started a testing center. So you just can't go there. They're going to not see you. But if you have an appointment, now we have a testing center on the western part of Cape Breton to be testing people.
Is that the closest one?
That's the closest one for people in western Cape Breton. My understanding is there's the one that was set up in Sydney, in Inverness, and there's also one being set up in Port Hawkesbury.
What services are being offered here in Chéticamp?
So in Chéticamp, if people think, again, if they think that they may have been infected or concerned about that, we would advise them not to come in. Use the system that's in place. So phone 811. If someone is feeling quite ill, we will see them in the emergency department. We have the ability we have special rooms that people can be isolated in, and the healthcare system has a team that we can get dressed in appropriate masks and gloves and gowns so that we would be safe when we see the patients. If patients are quite ill and they are coming to the emergency department, it's also important to phone the emergency department ahead of time so that we can be prepared before you arrive.
What would you say to people who had medical tests or procedures canceled?
Yeah, this is... I remember when I was in medical school, I took a course about the history of medicine, and we talked about how doctors 200 years ago dealt with infections and epidemics and pandemics. And this is really historic. It hasn't been, in North America, a long time for us to take such extensive measures. And some of those measures that we're doing is canceling routine visits. Certainly here in the office, we are dissuading people from coming into the office. Doctors in Nova Scotia now are able to treat people, talk to people, assess people over the phone. So our clinic is doing visits for people over the phone. Most things can be dealt with over the phone. If it's a prescription refill or if someone has a minor physical or mental complaint, we can help them over the phone. If we feel that they need to come in, then we'll make arrangements for that. So one of the things we're doing at the clinic here is being able to see patients, schedule them for phone visits. But a lot of things are being canceled. And so people's stress tests, people's minor surgeries and things like that are being canceled. And the reason is it is a kind of an all hands on deck mentality. We cannot have hospital beds or operating rooms or emergency rooms being used for things that could be put off a month or two. And we don't know how long this pandemic is going to last. Some people may find that frustrating, but again, the numbers I spoke to at the beginning of the interview, if 10% of the population in just this part of Cape Breton need to be hospitalized, that will be 700 people, and we have 10 beds. So we need to make sure that we are ready to deal with potentially a wave of very sick people. And to do that, we need to be canceling a bunch of other medical procedures.
Do you know if anybody here in the area has been tested already?
In the area here, there are people that have been tested. And to my knowledge, no one has tested positive on this side of Cape Breton. My understanding is that there is a positive test in Cape Breton, but more in the Sydney area. And I don't know specifics to that. That is meaningless, really, because if people are kind of waiting for there to be a positive test to change their behavior, they shouldn't. There will be positive tests in Chéticamp, in Inverness, and in between. This virus is already here. And as we increase our testing, as the testing site gets up and going in Inverness, there will be positive cases. Hopefully most of them will be mild. But the fact that it's negative today, in a few days, the numbers will start to go up.
Would you make any changes to the system that Nova Scotia has set up?
No, I think that one of the great things I'm realizing is that the whole healthcare system is working very well together. There is great communication from the health authority to physicians and to clinics. We are reacting as fast as a healthcare system can react, I think. We have set up testing clinics. We are making major changes in how we deliver care to patients, whether it be over the phone or over other virtual means. We are getting prepared in our emergency departments and in our hospitals. We are looking ahead to what would happen if there are staffing problems, if any of the doctors or nurses were to get sick, how we can adapt to that. And so I think I am proud to say the healthcare system is certainly doing the best it can in these situations.
Anything that you'd like to add?
Did I mention wash your hands and self-isolate? That's extremely important. People have to take this seriously. Minimize your interaction with people and wash your hands. And, we will get through this. Hopefully it will not be as bad as it could be. And that's the thing we have to remember, that this potentially could be quite devastating. But if we do what we know what we need to do, we can get through this.